In terms of kidney transplant recovery, the patients will be in the hospital for approximately 5 to 6 days, and that's to finish the initial healing process and the medication treatment, and then they are discharged home. They do receive a home health nurse that does come out to their house at least twice a week to help them with their vital signs, help take a look at their incision, answer any questions they have, and even help them with their pill boxes if they need help with that.
The person who donates a kidney in a live donor setting is typically in the hospital for a shorter period of time, typically about a day or two. Their recovery time is a little bit different. These are typically healthy people who don't have any medical problems, who out of goodwill donate an organ. So their primary issue for recovery is going to be pain control, which isn't terrible. I've seen people go back to work in a week or 2 weeks after donating a kidney. I always tell people if you have diabetes, hypertension, we don't cure those with transplant. So you still take diabetic medication, you still take blood pressure medicines. Now we add on anti-rejection medicine, some antibiotics, antiviral medications. We ask that family members be involved or friends so that things like cooking, cleaning, someone else can do that, those sort of things for you. You won't be able to drive in the first typically month or so post-transplant. So we ask, again, that family members, or we call a support team, is involved bringing patients back and forth to the clinic for visits. But the actual recovery time is fairly quick.
For patients to optimize their transplants and get the best success out of it, they need to be respectful of the gift that they are given. And that includes communication with their transplant team in all senses. If there's any questions, problems, concerns, patients do need to contact their transplant nurse or nurse practitioner after transplant. Communication is key. Patients physically need to take care of the transplant by making sure they're eating healthy, they're drinking fluids to keep that transplant healthy. After transplant, life does change for patients. So first of all, they no longer have dialysis. So they have a lot more freedom for travel, for visiting people, going out to eat.
Life after transplant, as long as you have a working kidney, is fabulous. You're not on dialysis. You're spending that 12 hours a week doing other things, being with family, grandchildren, children. Some people go back to work if they're a little younger. Some people go to college. There are some restrictions with infection like that. You need to practice health safety overall, washing your hands and staying away from people who are sick. But other than that, you would never know by looking at someone that they have a kidney transplant.
There's nothing about transplant that's perfect. So I won't tell people to expect a perfect outcome, but expect a good outcome. You're going to be taken care of by some really good physicians and care providers. Everyone on our team is very caring.
We really are personalized on our patient care. Patients are not just numbers to us, they are people, and we do care about their lives and their results and their kidney transplants.